Good evening and welcome to the New York City Health and Hospitals Fiscal Year 2022 Annual Public Virtual Meeting for the Borough of Brooklyn. Good evening, ladies and gentlemen. Before we start the formal program, I would like to call to your attention that we do have interpretation services. If you require these services, please call 212-788-3359 for French Creole, Russian, and Spanish. Thank you. My name is Frida Wong. I'm Vice Chair and also a member of the Board of Directors of New York City Health and Hospitals. I want to thank you all for joining us, and I'd like to introduce the other board members who are here tonight with us. Mr. Robert Nolan, the City Council Representative for the Bronx. Fenioski Peñamora, Sally Hernandez Pinheiro, and Dr. Mitchell Katz, President and CEO and also board member. Also on the panel this evening are Blanche Greenfield, our Deputy General Counsel, and she will be the moderator for this evening, as well as Calicia Hercules, Secretary to the Corporation. I would also like to acknowledge Troy Olson, Legislative Director representing Council Member Ina Vernikov, District 48, Sam Weinberger, Chief of Staff representing Council Member Rita Joseph, District 40, Lori Windsor, Brooklyn Director representing Congresswoman Nicole Malliotakis, District 11, and Jean Velasquez representing Congresswoman Yvette Clarke from District 9, all participating in a listening capacity. On behalf of the board, I would like to extend our thanks and acknowledge the leadership at our Brooklyn facilities to Sheldon McLeod of Kings County, Gregory Kalist of Woodhull, Svetlana Lipyanskaya of Coney Island, and David Weinstein of Susan Smith McKinney, as well as the dedicated staff from all our facilities for providing exemplary service to our public health system and the people we serve. And also to all of you here. Thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. Now I'll turn to Dr. Katz to provide an update on the activities of the system in the Borough of Brooklyn during the past year.
Thank you so much, Frida. And while I'm committed to all 5 of our boroughs, of course, I have a special feeling about Brooklyn since I was born there, went to public school in Brooklyn, used Coney Island Hospital as our family hospital. My older brother and sister still live in Brooklyn, so a very special good evening to my Brooklyn friends. We marked the sad passing of 2 years of COVID, where we lost many people we loved, our patients, our colleagues, family members. I am extremely proud, though, of how well Health and Hospitals performed in 4 of the outbreaks and the in-between times. Besides handling so many people who were sick and growing our emergency rooms and ICU capacity, we, over this 2.5-year period, we did 10.5 million COVID tests. Pretty much an amazing statistic. We provided 100,000 vaccinations. We did 1.7 million contacts through our test and trace effort. We helped 33,000 people to isolate. And in fact, we were the only city to have a hotel program to enable people to isolate safely from their families without risk of infecting them. We provided 2.2 million meals. And when people were in hotels, besides providing them food, we walked their dogs, we picked up their medicines, we took them to visits, we did whatever was necessary to enable them to keep others safe. Now we are providing aftercare. We recognize that for many people who had COVID, it's not over for them, that they continue to experience symptoms from long COVID, and we are committed to helping people to deal with those symptoms through both our specialized centers and through our regular primary care. We are also providing through our virtual care capabilities. Any New Yorker can call and get who has positive on a COVID test, whether that test is an at-home test or that test is one in the hospital. They can call our virtual line, which anyone can reach by calling 212-COVID-19 and be connected to a doctor, nurse practitioner, or physician assistant. For people who had positive COVID tests, we will arrange for them to receive a prescription at home of Paxlovid, if that's appropriate, or we'll arrange for them for an appointment to come in for a monoclonal antibody, if that's the superior care. But we're committed to both preventing COVID, to treating people who have COVID, to continue to treat people who have long-term symptoms of COVID, to do everything possible to help our city to get back to where it was. In terms of some specific news about Brooklyn, we were very happy to open up a COVID Center of Excellence in the Bushwick section of Brooklyn, which is now open and available to people for providing care for people who have long COVID. 3 of our hospitals in Brooklyn were designated as high performing by U.S. News and World Reports in several areas. We had at Coney Island Hospital a big assist from the Department of Defense during Omicron when we had so many of our own staff out sick. We're very excited about the opening of our new South Brooklyn Health and the Ruth Bader Ginsburg Hospital. It's going to be an amazing hospital, physical facility. I know people around Coney Island have seen it coming up, and soon we'll be able to tour you through it. We were very pleased that the new emergency room at Woodhall Hospital, which will make the physical facilities of that hospital as wonderful as the very loving staff that are there. Woodhull also was able to install new state-of-the-art MRI imaging for people for breast cancer screening. Also, we wanted to acknowledge that McKinney is one of our 5 long-term care facilities participating in the first edition of the Long-Term Care Equity Index, a demonstration of our continued commitment to providing comprehensive, culturally sensitive care to all our skilled nursing facility residents. So with that, I want to thank everybody for coming. Thank you for supporting Health and Hospitals. Through all of COVID, we felt so much love and support from New Yorkers who recognized how hard people were working to keep them safe. We are a institution full of healthcare heroes and sheroes and people who do get up every day to do their very best to deliver our mission of providing high quality care to all, regardless of insurance status or immigration status or any other factor. We're always here to care for people. We thank you for coming tonight. And with that, I'm going to turn it over to our legal counsel, Blanche Greenfield.
Thank you. As a reminder, if you're just tuning in, we have language translation services available in Spanish, Russian, and French Creole. All you have to do is call the number 212-788-3359. Thank you, Dr. Katz, and welcome to all. As Dr. Katz said, my name is Blanche Greenfield, and I'm Deputy Counsel here at Health and Hospitals. Due to COVID-19 public gathering restrictions, we are convening the 2022 public hearing for the Borough of Brooklyn virtually. This is the last of a series of 5 meetings conducted annually across the city's 5 boroughs. The purpose of the annual meeting is to inform you, the public, on the programs and plans of New York City Health and Hospitals, as well as to afford the public an opportunity to present oral and/or written testimony concerning New York City Health and Hospitals' performance. Public testimony, both oral and written, will be transcribed and forwarded to all of the members of the Board of Directors for their consideration. If you're tuning in and decide that you want to speak, please register. Registration is open till 6:30 by calling the number 212-788-3359. I will moderate the balance of tonight's meeting, during which the members of the public are invited to share your comments and concerns about New York City Health and Hospitals. At this time, I will briefly highlight the format and rules for your testimony. The most important point for you to keep in mind is that the members of the Board of Directors are here to listen to you and not to engage in a dialogue. This is not a question and answer forum. In order for each registered speaker to have an opportunity to testify, registered speakers are allotted 5 minutes of speaking time. On your screen, you will see an electronic timer that will provide you with warnings about the expiration of your time. A yellow light will indicate that you have 2 minutes remaining in your allotted time. A red light will signal that your speaker's time has elapsed, and a flashing red light signifies that you have exceeded your allotted time. If you do not complete your comments in the allotted time, and you have a written statement that constitutes your full remarks, you may submit your full comments by calling 212-788-3359 and making arrangements to submit the full statement into the record. Your written testimony, along with the transcript of your oral presentation, will be shared with the members of the Board of Directors. Kindly note that there is no transferring or sharing of time between speakers. Finally, although I try my best, I may mispronounce your name. Please correct me if I do so. I thank you for your participation, and we look forward to hearing your views. We ask that you please remain muted until your name is called and use the unmute icon on your device or *6 to unmute yourself, or if you are using a phone. We are ready to start with our first presenter, and I would like to introduce Jabari Brisport, New York State Senator, the 25th Senate District.
Hi, I'm mostly joined tonight, to hear the concerns of my constituents as well, and to thank New York City Health and Hospitals for just the incredible work that you did during the COVID-19 pandemic in my own district and throughout the city. Really appreciate you taking the time and making the space to hear from people of our great city. And looking forward to the dialogue and the opportunity for people to feel that their government is listening to them and will be responsive to their concerns. So thank you so much, and enjoy the night.
Thank you for your comments. Our next speaker is Mercedes Narcisse, Council Member, District 46, the New York City Council. We will come back to the council member. Our next speaker is Shahana Hanif, Council Member, District 39, New York City Council.
Hi, good evening, everybody. I wasn't aware that I'd be speaking, but I am happy to be joined by Health and Hospitals, and as was mentioned earlier, Brooklyn too is special to me. I was born in Maimonides and have received care from hospitals across the borough, including Coney Island Hospital. And so I am just here to listen and be a resource and learn from our constituents. Thank you.
Thank you. We appreciate your tuning in. Our next speaker is somebody we met earlier, Warren Burke, CAB Council Chair, Health and Hospitals Community Advisory Board.
Hi, everybody. Good evening. My name is Warren Burke, and I am the current chair of the Council of CABs, which are Community Advisory Boards. First, I'd like to thank Dr. Katz, as well as Bob Nolan and the rest of the board for giving us this time. I am not going to comment too much upon COVID care because it was just fantastic. And having lived through it, we are just all thankful, and our residents are thankful for the care that Health and Hospital has given us. What I really like to focus on is the CAB Council and our CABs. For you who aren't familiar with it, each of the major facilities has a CAB, which is a community advisory board. And the major function of these boards is twofold. They're a conduit to bring residents' concerns to the facility in their catchment area, as well as to bring to the residents information about what's going on in the hospitals. And I have to tell you that I've been a member of the Kings County CAB for a while, and they're just exemplary. What I like to focus on is leadership and leadership participation in the CAB, individual CAB's activities. For instance, at Kings County, the leadership is at all of our meetings through Mr. McLeod and the other participants in leadership. They are at our monthly board meeting, and they are at each of our committee meetings. And that's the way it should really be. Maybe I've been spoiled, but that's how I was brought up through the system by the leadership of Kings County. And unfortunately, I'm concerned that this is not happening throughout the facilities. It is extremely important that the CABs at each facility gets the information they need to operate, to be conduits in both directions. And in order to do that, they need data. So at this point in time, I've done a little survey, and it was really brought to me by a couple of CAB chairs. And these chairs have said that their CEOs are, how should I say, limiting the information they're getting. In the worst case, there is one hospital CEO that is saying they'll only give the information every 3 months, while it should be monthly. And I want to suggest to the board of directors to take a look at this. The CABs are truly integrated and monitored into H&H through Deborah's Brown division. We have great people who liaison and all the liaisons within the hospitals, and we'd like to have some accountability from the CEOs. And that's basically my statement. I do want to thank the CAB chairs that are here. Teresa Scavo from Coney Island, Francesca Leopold from Kings County, Jose Guzman from Woodhall. I don't know if Vera Gibbsy here from Gotham East or Corey Evans, and also Antonio Pierre from McKinney. And they've received a number of terrific awards this year. These people are the leadership of the, and I just want to thank them for their good work. Thank you.
I don't think, Blanche, we couldn't hear you.
And I agree. I could not hear her either.
I apologize. That was my fault. I wanted to thank Warren Burke for his comments, and our next speaker is Teresa Scavo, CAB Chair, Coney Island Hospital.
Good evening. Thank you to Dr. Katz and the members of the board for attending this evening. I am Teresa Scavo, Chairperson of the Coney Island Hospital Community Advisory Board. Coney Island is in the midst of a campus-wide transformation, which will now include a new campus as well as new hospital names. On July 29th, 2021, the New York City Health and Hospitals Board of Directors approved a resolution to rename the hospital campus as the New York City Health and Hospitals South Brooklyn Health, and its new inpatient hospital, which will be comprised of a new 350,000 square foot building, and the existing tower building will be named the Ruth Bader Ginsburg Hospital after the late United States Supreme Court Justice. Both names will be effective in the fall of 2022 when the new building opens. Other parts of the campus renovation, including a brand new circular driveway, are expected to be completed in 2023. With 4 months remaining before the new hospital opens, the staff at the future South Brooklyn Health are working to prepare for opening day, including launching a nearly $1 million advertising campaign, training and orienting staff who are moving into the new building, preparing for the New York State Department of Health survey to ensure the building is ready, planning department and patient moves into the new building, and occupying the building with patients and employees. I would like to congratulate Coney on their efforts throughout this COVID pandemic. As of June 1st, 2022, we have fully vaccinated, meaning 2 doses, over 28,000 community members. All of the staff at Coney are fully vaccinated, and we continue to run the vaccine center with appointments and walk-in hours. All community members over the age of 5 are now eligible to receive the Pfizer COVID-19 vaccine. I would like to publicly thank the borough president for nearly $12 million to renovate the 8th floor of the hospital's main building to create a comprehensive women's health service floor. Thank you to the New York State Assembly, over $1 million to replace 6 echo ultrasound units to support the expansion of our cardiac services, and to the members of Congress, $2 million to acquire new ultrasound units for our inpatient and outpatient services and brand new digital care experience technology. During review by the Joint Commission, Coney had a successful Joint Commission survey in the fall of 2021. The surveyors were complimentary of the staff and great work happening at Coney. Accolades include the teamwork and engagement from all members of the patient care team, how well we maintain patient safety despite an aging infrastructure, the commitment of our behavioral health staff, especially the ACT and chemical dependency teams, in helping a very vulnerable patient population. Our staff wellness programs, including our Helping Healers Heal and workplace violence reduction initiatives. Documentation on patients' preferred written and spoken languages, a high level of patient infection control processes, and completion of employee competencies. Coney has been recognized and awarded. Coney was ranked 7 among the top 10 hospitals for community health investment in the United States, according to a ranking published July 12th from the Loan Institute, a nonpartisan healthcare linked think tank. The report examined 3,641 hospitals based on Medicaid revenue, charity care spending, and other community health investment.
Yeah, I'm sorry, but your time has expired. If you can just please sum up your statement for now.
I would just like to thank everyone for their attention, and please always keep Coney in your mind.
Thank you so much for your very detailed comments. Thank you. I understand.
Thank you.
Thank you. I understand Councilmember Mercedes Narcisse is available. If you are ready.
Hi, good afternoon, everyone. I'm in the road, so sorry for the setting. I'm driving through, but I just stopped to say hello because I was coming from Manhattan. It's been a lot, so it's a pleasure to be here. I'm a chair for the hospital in New York City and registered nurse for over 3 decades. Work in hospital. Should I say my hospital? Work at Elmhurst Hospital, which is a H&H. And it was a very, very great experience for me to start my life. As a chair of hospital, I'm fully ready to take my firsthand experience and do all I can do to ensure doctors, nurses, and all hospital staff have the resources available to serve them, to provide the best healthcare for all New York City, all our New Yorkers. I'm excited to bring the frontline workers' point of view and to address the needs of our healthcare delivery system. We've been hit with a pandemic. That's the first time ever, and our frontline workers were there for the people of the city of New York. Right now is to address the needs of our healthcare delivery. So whatever I can do. I know this pandemic has highlighted the problems that we never faced before. We knew that Coney Island was took the brunt of that pandemic, and Elmhurst Hospital and so many others, Kings County. But we know for my community in the 46th district, we don't have any hospital, any community health center. So most our people from the 46th district either go to Brookdale Hospital, Kings County, or Coney Island. It is for me as a nurse to follow through and do whatever we can do as a city to make sure we address the inequities in healthcare. I'm happy to report that H&H received $41 million in capital budget funding in this year budget. That passed last night late. It was about 11:05, but we stay there. We fought hard to try to get to bring the equity that we've been talking about. And mental health get a big part too as well. And that was the first time we allocated $5 million to make sure that the folks that never been able to get mental health addressed to get some support. It's a beginning. It's nothing perfect. The budget was not perfect, but it's a great start for better tomorrow. This is such a pivotal time for our city hospitals. I will continue to look back to the efforts. I mean, from the effects of the COVID, we know about long COVID. It is imperative for us to continue providing the care in our community, which has decimated our hospitals. We know that. In particular, New York Health Hospital. We know the safety net hospital in traditionally underserved communities. They are they need a lifeline, and we know that. We know that they need our immediate attention, and that's the reason we're trying our very best from the city level to make sure that we provide the needs and the for our hospital. I assure you that I will continue to be strong for H&H facilities because those are the hospital that serve the underserved community, the high-risk community we're talking about. I understand the value they have in our community, and I stand to fight for a long-term sustainability for our hospitals. And as a nurse, that's what I'm here. Once a nurse, always a nurse. I'm going to continue putting our hospital H&H in the forefront. So I thank you for the opportunity. Then I'm going to continue listening to see the needs, whatever I can do to my capacity, and all the city council members. We have a holistic approach. That's the first time we have 31 women serving. We're trying our very best to deliver for our city, and most importantly, healthcare. So thank you. Thank you for your time. Thank you.
Thank you very much for your comments and for your support. We're fortunate tonight we have a whole panel of members presenting this evening. So our next speaker is Jose Rolando Guzman, CAB Chair, Woodhull Hospital. Welcome.
Good evening, everybody. First of all, I want to thank the elected officials present, the health and hospitals leadership, Dr. Katz, and the board of directors, and to all the other present this evening. My name is Rolando Guzman, and I'm the chairperson of Woodhull Hospital Community Advisory Board, and I'm also a resident of Brooklyn. First of all, thank you so much for allowing me the time to speak on behalf of Woodhull Hospital CAB. I would like first to express my gratitude to Mr. Gregory Callist, our Chief Executive Officer, to Woodhull staff, and to my fellow CAB members for the dedication and commitment to improve Woodhull Hospital and providing excellent health care for residents of North Brooklyn, especially during the COVID-19 pandemic. Our CAB is fully supportive of our CEO vision of making Woodhull a model hospital and the hospital of choice for North Brooklyn residents. And we are fully satisfied with the partnership and collaboration with our hospital leadership and staff. In addition of being a CAB member, the community members that I work in North Brooklyn and myself are also patients of Woodhull. So I have a vested interest in ensuring that Woodhull is the best that it can be. And although we have other options for healthcare, we choose Woodhull Hospital to be our healthcare provider. Woodhull has made significant progress with access to primary care and reduce the waiting time for first-time appointments. We need to retain our healthcare providers and recruit new ones in order to further improve the access of care, which is consistent with Dr. Katz's goals. We understand that salary is a big factor, and we ask the board of directors to consider increasing salaries as much as possible to make them more competitive with the rest of the industry in order to recruit and retain the best healthcare providers possible. Unfortunately, many specialty services in high demand by our community are either not available at Woodhull or the waiting time for appointments are far too long. This gives us not other options to seek care somewhere else. This is obviously not good for our residents, the hospital, and even the managed care companies that insure us. We understand that specialty services cannot be provided at one community hospital, in a single community hospital like ours, but a bigger effort should be made to offer specialties that are in high need to our community. We are very grateful with the emergency department expansion and renovation. This has improved the access and operational flow by gaining 16 treatment spaces, nearly doubling the existing treatment space from the old acute ED. I especially want to thank Councilmember Antonio Reynoso for his support, but we still need to renovate the old emergency department area and to bring it up to par. We understand that the plan calls for additional trauma in critical care base and procedure rooms, as well as a state-of-the-art critical trauma suite that will allow our staff to treat emergencies such as cardiac arrest, strokes, MVAs, and gunshot injuries. Those are some of the issues that we have to deal at Woodhull on a daily basis. We are hereby requesting the support for this enhancement. Behavioral health continues to be a major service at Woodhull, and although the need continues to is increasing, the services are shrinking. We understand that this is happening because of the lack of psychiatrists and other mental health providers, and due to the non-competitive salaries. We are therefore asking for your help to help us reverse this trend in order to continue providing these critical services to our communities, especially those in need of mental health or chemical dependency. The CAB and community are also concerned about the corrections outposting project, which will turn over the 9th and the 10th floors to corrections for their inpatient units. This is not only will significantly reduce the space available to Woodhull and limit our ability to grow, but in addition, the community is concerned about the safety and security with the placement of prison incarcerated population at Woodhull. We need to ensure that there is a close collaboration and planning between Woodhull and correctional health to minimize the impact of this major project to Woodhull and our community. We continue to do all we can to make health in hospitals and Brooklyn proud of Woodhull. The fact that Woodhull has been leading the way with so many healthcare initiatives and awards in Brooklyn is a true reflection of the dedication and hard work of the staff and the community. Thank you so much for your continued support, especially to the boards of directors and leadership of health and hospitals, to making sure that Woodhull continue to be a successful hospital and the #1 choice for North Brooklyn residents. Thank you so much.
I apologize, I forgot to press the mic. So I wanted to thank you very much for your comments, and our next speaker is Francisca Leopold, CAB Chair, Kings County Hospital.
Hi, good evening, everyone. Good evening, good evening. Thank you so much for giving me the opportunity to share with you as to what we are doing.
There's an issue with your connection?
Can you hear me now?
Yes, thank you.
Okay, thank you so much. Good evening again to everyone. My name is Francisca Leopold. I am proud to serve as chair on the Kings County CABs. It is indeed an honor to serve alongside my CAB members, our CEO, Sheldon McLeod, medical leadership, Ms. Alexis Davis, and the public relations division staff. I want to take this opportunity to recognize the CAB's strong partnership with our hospital leadership and the staff. The hospital leadership, as you would have heard before, attends all our CAB meetings with the intention, enthusiasm, and attentiveness to address any concerns that the CABs will bring to them. Leadership also keeps us abreast of critical developments happening in the hospital. They share pertinent information and answer questions as they arises and diligently try to solve as many issues that would arise at the hospital from our communities and inside. I now would like to share a few achievements for Kings County and also share a few of issues that are impacting our communities as well. Throughout this pandemic and with the most recent influx of COVID-19 cases, Kings County has consistently worked hard to fight for the safety of our community, the patients, as well as the employees. I'd like to publicly recognize Kings County Trauma Service Team for the fantastic work during the the fantastic work during the American College of Surgeons recertification survey and passing with zero deficiency. Additionally, I'd like to highlight that the American Heart Association has nationally recognized Kings County for the commitment to improve cardiac arrest survival rates. The American Heart Association presented the county with the Get with the Guideline Resuscitation Gold Award for proven dedication to ensure in-hospital cardiac arrest patients have access to best practice and life-saving care. Kings County also received the Get with the Guidelines Stroke Quality Achievement Award for our commitment to ensuring stroke patients receive the most appropriate treatment according to national recognized research-based guidelines, ultimately leading to more lives saved and reduced disability. And I must say personally that I know of 3 to 4 patients in the last month who would have gone to the hospital, the loved ones would have had suffered strokes, and then they have nothing but rave reviews for the stroke team that saved the lives of their loved ones. I'm proud to share that Kings County is launching the nation's only active curriculum structured clinician forensic medical fellowship. The fellowship will highlight the ability to identify and care for the victim of violence and trauma by receiving formal training in clinical forensic to prevent the destruction of pertinent evidence, assist in legal proceedings and documents and recognizing patterns of violence and abusive behavior. The fellowship will be a significant asset to our community and patients. I would also like to turn to a few of the issues impacting our community. Behavioral health stigma, impact of ongoing COVID-19 pandemic, access to affordable housing, public safety and crime, and also obesity because of the lack of healthy food in our community. I know that the leadership and staff are consistently working to provide compassionate, high quality health care to the residents of the growth borough of Brooklyn and seek solutions to combat the issues facing the community. Based on my interaction and information from our residents, I am pleased to report that they value and appreciate the care they receive from Kings County. And we also have our newly formed outreach committee who is striving to bridge the gap between the hospital and the community. I thank you so much for having me, and I thank you for listening.
Thank you so much for your comments this evening. Our next speaker is Deborah Greif, chairperson of the Brooklyn Family, I'm sorry. Our next speaker is Corey Evans, cab chair, Gotham Health, Cumberland,
Good evening. How are you?
Fine, thank you, and I apologize for almost skipping you over, so welcome.
No problem. No problem. Good evening. My name is Corey Evans. I'm the Community Advisory Board Chair. Completion of the facade project improving overall aesthetics of Cumberland internal facade, expanded COVID operations due to COVID variant 7 days a week. PCMH recognized award, Patient Centered Medical Home. The PCMH CCE Quality Award recognizes outstanding certified content expert or CCEs who have been nominated for their work supporting practices with transformation maintenance of the PCMH recognitions. Successful Article 28 survey minimal findings. Article 28 is New York State public health law that recognizes and regulates the accredited public health care facilities. Something like Joint Commission, but the clinics, it's called Article 28. The implementation of 4R VRI interpreted units in the clinic for improved language interpretation services to our patients. VRI stands for Video Remote Interpreting, which refers to reaching a language or ASL interpreter over a video call. VRI marries the benefits of face to face interpretation with the on demand, mature, over the phone interpreter. Benefits of VRI visual interpretation, immediate connection, high qualified interpreters, private calling. Many languages are offered as well as sign language. OSHA successful survey for chemical dependency program. Donations, all Gotham sites received donations. Cumberland received donations from the Frontline Impact Project and Lewinsky Foundation for the healthcare staff and frontline workers, such as snacks, beauty products, samples, and donations listed below. The donations of the clinical equipment from ALFA organization, CHA, CYS, Community Healthcare Associate of New York State, donated hospital equipment to Gotham City late sizes, feminine products, which also helped the community. LQBT Healthcare Index Certification Award for Cumberland. Cumberland COVID team recognized as healthcare heroes showcase in Commodore Park. The community got together and nominated Cumberland as healthcare heroes, and articles were written recognizing Cumberland as hard work dedication that was displayed during the pandemic to keep the community safe. The recognition ceremony was held at Commodore Park where the photos of Cumberland staff was taken and is currently displayed in Commodore Park. Unveiling of the pediatrics painted by local artists. The mural was donated to Cumberland by the local artists. Cumberland staff also took part in completing this mural with direction from the artist. The mural is currently displayed in the Cumberland Pediatrics Department. It raised over 5K for the breast. We raised over 5K for the breast cancer awareness. Special thanks goes to the Health and Hospital and Dr. Katz, as well as Ms. Lewis and the CEO Gotham Health for continued support of Gotham Cumberland. The Community Advisory Board would also like to thank Ms. Clark, Senior Director, Mr. also Melvin DaCosta, Director of Patient Relations, and their continued support and leadership with Cumberland. And that concludes my report. Thank you.
Thank you very much for your comments. Our next speaker is Deborah Greif, Chairperson of Brooklyn Family Support Services Advisory Council, Coney Island Hospital. Welcome.
Thank you very much, and I also thank you for saying my name correctly. I appreciate it very much. Okay, as I said, my name is Deborah Greif, and I chair, and I'll explain quickly, the Brooklyn Family Support Service Advisory Council. Our role is to help families who have children with developmental disabilities be able to keep their family living at home with them. I chair Brooklyn, but I represent Brooklyn in Albany. I also am a 40-year patient for Coney Island Hospital. I gave birth to my son, Christopher, there. And yes, my late mother, Bernice Greif, did pass away there, but I was happy. Before you want to say she's morbid, no, it was much better. She died with dignity, and she was because of being that she died at the Coney Island Hospital, I didn't have to answer to the coroner. And the other part, I was very happy we were able to donate her body to medical science, because at that time, when she died in 2001, very little was known about women who had heart disease and how it affected them. We have received, now the one thing I am a little sad about with Coney Island Hospitals, like I am with the others, you used to have a child development unit that would work with families who had children with developmental disabilities. I hope you bring it back, and when you have the new building open. Also, you need to improve signages to be a lot larger. It is very hard with people with disabilities to see them. They do get mixed up very much. I also would like you to have more of your staff be trained on how to work with people with disabilities, all types. I appreciate now that at least when I have to go to the ER with take my son or help another family with children with developmental disability, they understand that someone from OPWDD has to be with them. We appreciate that support very much. We do have issues, though, when it comes to our food allergies and food sensitivities. You don't work with us, and I've had the union person say, oh, I was making a joke out of it. Well, let me tell you, my pulmonary doctor who runs your medical IC unit tries everything to make sure before I should not be admitted. Why? Because I have such bad food allergies with all the mistakes that were made, it will be very bad, and I could have another cold blue asthma attack. So we do everything we can to keep me home. It's also true of all the other hospitals, but Coney's the hospital I have my child and get the care. I hope you can fix that problem and listen to us more. I also would like to see your rehab PT division improved. It's first of all, I'm not complaining about it. They do an excellent job. I broke my foot 3 years ago. I had a mild concussion, and let me tell you, I'm able to walk. Yes, I have to use a walker, but that place gets packed, and we have a waiting list. I really hope you can expand the gym for them as well as for the OT. There's so many people that need the services, whether they're young or old. Also, please improve, also have speech testing for people with disabilities from birth up to adult. Also improve your auditory. You need more people doing auditory testing for people who may be going deaf or children with auditory processing. In reference for females, please bring back and have a breast MRI at Coney Island Hospital. You used to have it before Sandy. And let me tell you, it was a lot easier to get my breast tested. I have fibrocystic breast disease, and I'm positive for BRCA1 and 2. I cannot take any more MRIs unless through blood work and a sonogram they see that I may have breast cancer. Please also do the BRCA1 and 2 testings either at Coney or Kings County, because otherwise we have to go all the way uptown to Mount Sinai. I prefer staying at Coney or go to the Kings County to have the test. I would appreciate if you would also have your staff be trained that when a woman says, we're told not to take mammographies because we're positive for BRCA1 and 2, which means we could get breast cancer from taking a mammography because of radiation. Now, every time I have to have an x-ray done, they do give me a lead shield for my breast. Please make sure that the rest of the staff understands that. And please expand your sonogram department. They need more staff. They do an excellent job there. And I appreciate all the hard work they do there, but we need more staff there. Thank you very much for allowing me to speak.
Thank you so much for sharing your very personal comments. And the next speaker is somebody now that has already been introduced. It's Christopher Greif, Vice Chair, Advocate for People with Disability, Coney Island Hospital. Welcome. Christopher, louder.
I am speaking a little louder. If I speak any louder, I might blow out the mic systems. As I say again, good evening, everyone. I'm Christopher D. Greif. Some of you know me as Transit, but today I'm here as an advocate, but also Vice Chair of the Brooklyn DD Council, as well as the correspondent secretary to the Advisory Council. As a patient in Coney Island Hospital for 39 years, I was born there and I've been raised there, so I know what the hospital's been doing. I even seen how the Mark III elevator's been built. Now, one thing I agree with the chairperson as well as AKA my mother, we do need to update the 21st century. Somebody coughing? Okay. As I was saying again, it is very important that we need to upgrade signages to make sure that people who can see the signages and go in the right directions, because as you're aware, that signages is very important, where they should be entering, where is the accessible entrance, where the accessible bathrooms are. We need to make sure signages are a little more bigger, not small, because as you know, we're in the 21st century. As Ms. Greif also mentioned about food allergies, we need to also remind that some of the waters, and I mentioned last time I was here, dense water is sulfates. There are a lot of certain stuff and diet stuff have sulfates that can hurt asthmatics or a person who has severe allergies. People with disabilities, my fellow disability people who love going to Coney Island Hospital or Kings County, cannot get a decent sometimes food because some of the food they have has sulfates. There are a lot of people are allergic. We need to be very careful. And I always will say this: I will always drink nice water because doesn't have sulfates. It's clear, or you put something in just to make sure to keep you hydrated during the summer. But sulfate water does not help. And I'm very glad to see that the COVID test, as well as when you're getting your booster shots, are in the one easy location and it's accessible. So we still need to work together. For my fellow disabilities, can go to any of the hospitals in all the 5 boroughs. And I'm a very big supporter of Brooklyn South, and I'm still going to say Coney Island Hospital because it is a legendary hospital in Brooklyn. Since it's Brooklyn South, which I can see it from my window, I am very happy to see that the hospital is being updated with a lot of new things coming in. But again, we do need to make sure that that hospital is 1,000 million% ADA accessible for seniors and people with disabilities. And let's try to keep that reminder that we need to make sure that parking areas must be clear for accessorize. Those special vans that patients are using, as well as the bus stops, must be clear. And it's not just at Coney Island Hospital, it's on all the hospitals. We need to make sure that sidewalks are clear for vehicles to get the seniors and people with disability on and off safely. Thank you, everyone, and happy 8832 for next month. And happy Flag Day.
Thank you so much. And I see you wore the shirt to honor the holiday. Okay. Our next speaker is Hector Feliciano, Director of College Prep GED Program. All right, we'll move on and come back. The next speaker is Shani Auden, Community and Government Affairs Liaison for Kings County, Live On New York organization. Welcome. All right. How about Anthony Feliciano, Director on the Public Health System? Are you here, hopefully? All right, moving down the list, Julia Savinkina, nurse, Coney Island Hospital. All right. How about Cody Souffrant, Director of Higher Education Opportunity Program, Barisha College? No? All right. And the final speaker that I have for the program this evening is Leonette Benoit, Counseling Coordinator of the Higher Education Opportunity Program. Are you available? No. Is there anyone else? Well, at this time, this concludes the registered speakers that we have for this evening. I want to thank you all very much for your participation in the program. This, as you all know, it is very important that we all hear from you, the people who are served and who actually help us deliver on our mission. So thank you very, very much for your participation this evening. Good night.
Good night. Have a great evening, everyone.
Thank you all. Have a good night.
Good
Thank
night,
you.
everybody. Thank
Good
you
night.
for having us.
And happy Flag Day.
Happy
This
Flag
meeting
Day.
is no longer being
Bye-bye.
recorded.
Yeah, he's happy. It's Flag Day. Bye-bye, Teresa.